Today I would like to show you a stretch for the hip joint that allows you to recover from an injury, especially if all of a sudden you started to feel stiffness or pain in your hip joint and you don't know what caused it or where it came from. Perhaps you just got back from a run or a lower body workout and it's just not feeling so good. Here's a great stretch for you to try. It's called hip extension. It involves you getting into a lunge position where one leg will be forward and one leg will be back. The leg that is back is going to be the painful side or the stiff side. And what you're going to do is you're going to lean forward into the stretch so that your thigh bone, your femur, will be moving behind you while the rest of your body is moving forward. This movement is very often therapeutic to the hip joint itself and allows you to recover from a new source of pain. Let's see how it works. To perform the hip extension, you will need some sort of cushioning for your knee. Usually a pillow will do. I have this AirX foam pad that I can use just to give my knee some support so it's nice and soft. Okay, this is the hip that is painful or stiff, right? So that my lower leg, my tibia and fibula, are actually pointing straight behind me. A lot of times the tendency is to rotate like this, where you're kind of externally rotating your hip. You want to be straight on. Hand goes on the back of the pelvis / hip area. To begin the movement, you lean forward, extending the hip, pushing the femur bone backwards. And then when you get to the end range, you can either hold it or you can apply a little bit of extra pressure with the hand, hold for 3 seconds, and then come out of the position. Feel the stretch or add a little overpressure if appropriate. 1, 2, 3, and come out of it. Again. And back. If your hip is feeling really stiff, it may not extend as far, and so you might have to start with your hip flexed a little bit, like this, so it's kind of like pointing forward just a little bit. And then from here, you would lean in and go as far as you feel comfortable going. If you get this far and you feel a stretch, that's fine. If you can go further, that's good. And if you find that this knee is bending a lot, then you can again bring it forward so that you have more space, and then you can lean forward and get into that stretch. If you found that performing this stretch allowed your body to feel looser, you felt less pain, and perhaps you even felt that activities beforehand that were painful or stiff are now looser and feel better, that's great. That's what you're looking for. That means that this stretch is benefiting you directly, and you should continue to perform that stretch ongoing. If, however, it didn't feel so good and you didn't get the result you were looking for, it's okay. No need to force it, maybe even stop this move altogether. The hip flexor stretch is sometimes also synonymous with this type of movement. And that is because the muscles that flex your hip are in the same area and also will be stretched when you move your hip into hip extension. They're not the only things that are stretched in this position, but they are part of it. And oftentimes when someone recommends a hip flexor stretch, they don't realize they're also recommending a hip extension stretch. And this is good because oftentimes these tissues need that stretch because it loosens things up, it allows that joint to move better, and it can help you to recover from any kind of injury that you're having. I hope that this information has been helpful, and I hope you have a great day. Thank you.